Today is September 12th, 2019. This is Rita. Hi, Rita.
Hi.
Rita came into the office in mid-April of this year, and Rita's been on her own health journey over the last 5 months. Rita, first of all, where did you come from?
From Arkansas.
From Arkansas, we're in Minnesota. Rita's in Arkansas, so I'm curious, how far of a drive is that?
It's about 712 miles.
712 miles. You've made the trip now 2 times,
Yes.
correct? And thank you for your effort on even doing that. How did you find me? I'm just curious.
I was looking on the internet for some type of help for my lung issue.
Okay. And you found us, you set up an appointment, you came mid-April, and what were you exactly wanting to be seen for?
I was wanting to be seen to help improve my breathing and my overall health because I felt like I was just fading away.
Okay. And how severe was it, did you feel?
I felt that I wasn't going to be around that much longer.
Okay. And what happened? What did we do?
A whole battery of tests, a lot of questionnaires, and then sharing of results, and then a nutritional program was initiated, and supplementation.
So we changed your diet
Yes.
fairly dramatically, right?
Yes.
We did food sensitivity testing. We got you on a clean diet,
Yes.
and then added nutrition in to help supporting your body's recovery process. But before we get into that, just real quick, how severe of a breathing problem did you have?
If I was to vacuum the rug, it would take me like half an hour to do a small room. I'd have to do a little bit, then stop and rest because my heart would be pounding and I would be out of breath.
Okay. And do you know what your oxygen saturation was at that time, approximately?
Whenever I exerted myself, my O2 sats would drop down into the 80s.
Okay, mid-80s?
Mid-80s.
Mid-80s. And how long would it take you to bounce back after you did attempt to do a room like that with your breathing and your heart rate?
About 20 minutes.
20 minutes. And that just felt like it was getting worse. Is that what I'm understanding?
Yes, it was getting worse.
And I'm just curious, too, with your energy. How was your energy at that time?
I had no energy.
Meaning?
I got out of bed dragging and I drug all day long.
Okay, so life was challenging to say the least.
Life was a drag.
Life was a
Pun
drag.
on words,
Yeah.
yes.
So we instituted all those things after getting your test results. You started on your journey. What's happened?
I'm only on one inhaler now.
Versus?
2 inhalers, and actually, 3 inhalers, nebulizer treatments, and a rescue inhaler.
And what has happened with your breathing?
It has improved tremendously. I can vacuum the whole house now, and I do not have to stop and rest.
And when you do your O2 stats or saturation,
They're in the 90s.
you're in the 90s?
Anywhere between 94 and 98.
Between 94 and 98 when you're not active or when you
When
are?
I am active, when I am exerting.
So it's come up from the mid-80s to the mid-90s.
Yes.
Big change. How's your energy?
My energy's much better.
Much better.
Yes.
So what level of improvement would you say you've had in the 5 months that you've been working at this compared to where you were when you came in as to
I've
where
had
you are now?
80% improvement?
80% improvement. That's tremendous.
It is. It is.
Is there anything else you'd like to share with, well, let me ask you this question. How difficult was the implementation of the program?
The implementation of the program. The actual taking of the supplements for me is kind of challenging because I choke on pills.
Mm-hmm.
So everything goes into liquid and I drink it.
Mm-hmm.
So it's kind of ghastly, but it's doable.
Okay.
And it just depends on how much you want to improve, what your desire is. It's hard.
Mm-hmm.
The food choices are hard because after the allergy testing, I was sensitive to so many different foods. And all of the healthy foods that I thought I was eating, like avocados and almonds, and I could not eat because I was allergic to them. So, yeah, for me, the program was very challenging, but it was doable.
Okay.
So it just depends on your desire.
Desire is everything.
How, I feel like I'm going to be around now for quite a while.
That's so awesome. Do you have any advice for future patients?
If you're struggling with a health issue, come and see Dr. Joe. I'm sure that he can take care of you.
That's kind, Rita. Rita, will you give me your permission to share your story with doctors or students or patients
Yes.
anywhere? Any restrictions on that?
No.
Thank you so much for taking the time. I'm thrilled with your improvement, and I think you can be even better. God bless you.